Hello and welcome to today's webinar on addressing food insecurity among young children during the pandemic, made possible by the Robert Wood Johnson Foundation. Before we get started, I'd like to quickly go over a few logistics. To eliminate background noise, phone lines are being muted during today's event. There will be a moderated question and answer session following today's presentations. You may submit a question online anytime by clicking the Q&A icon located at the bottom of your screen. Instructions are shown on the screen at this time. Today's event will be recorded and the slides and recording will be shared publicly on chcs.org. At the end of the webinar, we ask that you please complete a brief online evaluation that will pop up on your screen. Your feedback is very important to us and we hope that you'll take a moment to do this. I will now turn the webinar over to Armel Cazo, Senior Program Officer at the Center for Healthcare Strategies.
Thank you so much, Travis, for starting us off and for assisting with the webinar today. As Travis mentioned, my name is Armel Cazo and I'm with the Center for Healthcare Strategies. This webinar is first in a series of early childhood and Medicaid innovations amid COVID-19. We are so grateful to the Robert Wood Johnson Foundation for their support for the Aligning Early Childhood and Medicaid initiative, which is focused on aligning state programs and investments between Medicaid and early childhood systems to drive more strategic, evidence-based investments for infants and toddlers in low-income families. This initiative is also focused on demonstrating the value of early childhood cross-sector alignment for improving near and long-term health and social outcomes. Our partners on this initiative are 0 to 3, the National Association of Medicaid Directors, Social Determinants of Health Consulting, and the Public Leadership Group. Next slide. Oh, sorry. You were on the right slide, Travis, sorry. So the one before. No, you're right, sorry, my bad. So over the next 2 weeks, we are gonna have 2 webinars in that series that we encourage you to register for on our website. In next week's webinar, so next slide, sorry, Travis, I had it wrong. In next week's webinar, the early childhood and Medicaid experts will share strategies to support child and family well-being in the current COVID-19 environment and beyond, including connecting them to community resources, strengthening parents' knowledge and skills, and improving the effectiveness of virtual home visits. And then in the last webinar at the end of April, panelists will discuss how states and communities can support the learning and social and emotional development of young children as they re-enter early childhood and learning settings after local lockdown restrictions are lifted. Next slide. Today, we're going to hear from presenters and organizations and agencies from the states of Vermont and Washington, and we're going to explore state and local innovations that help address food insecurity impacting families with young children, effective practices from the pandemic that can be continued and expanded post-COVID-19, ways that food security and other social determinants of health needs can be framed from a resilience perspective, and the role of early childhood systems in supporting families holistically. We're going to follow those 2 sets of presentations with a Q&A and then wrap up with the webinar. Next slide. Our speakers include Daniela Louie, who will frame the webinar and who will also moderate the Q&A. From the state of Vermont, we will hear from Beverly Boguet, Tanya Lachapelle, Lauren Smith, and then from the state of Washington, we're going to hear from Taylor Kennigan and Stacy Cernick. And to start us off, I'm going to now turn it over to Daniela, Managing Partner at Social Determinants of Health Consulting. Thank you, Daniela.
Thanks so much, Armel. So next slide, please. So I'm just going to frame, again, big picture of why we're here and what we're talking about. I'll be pretty brief. The first part is to talk about how prior to the pandemic, the US was actually doing better than it had been doing since the 90s with regard to child food insecurity. So the rate was about 1 in 7 children were hungry. So as expected in 2020, the number skyrocketed because of the pandemic. So we got to about 20%, so 1 in 5 children in the US were experiencing hunger. And so the projections for this coming year, 2021, are about 1 in 6. So it's really just important for us to realize that as the nation's starting to heal and vaccines are starting to happen, we still have to be thinking about addressing these basic needs probably for the foreseeable future. So hopefully some of the innovations and approaches that you'll hear about today are things that you can bring into your own communities. Next slide. Also just wanted to flag that, as we know, not all communities are impacted equally. And in fact, Black and Hispanic households in the US with children are almost twice as likely to be struggling to afford food during the pandemic. For example, this past summer, about 39% of Black households with children and 37% of Hispanic households with children experienced food insecurity, compared to only 22% of white families with children. Next slide. One of the things that kind of brings both Vermont and Washington, a common tool and platform that you're going to be hearing about is the Help Me Grow platform and that system. And so just wanted to give a very quick overview so that when you start to hear about it, again, I am not the expert, but we have the panelists are experts on Help Me Grow. So basically, it's a system that can address social determinants of health needs and health needs, including food insecurity, which is how it's coming up in this webinar. So basically, they've got what they do is they can be at a statewide level, a local level. We'll have an example of each. And if they have a current directory of all of the different resources that children and families need, particularly for young children. So it could be health, it could be nutrition, it could be parent supports, early learning opportunities. And they both connect the providers so that they can have a seamless referral process, as well as connect the families directly to the system. So they have 4 main components that you'll learn about. One is the centralized access point. Another is the family and community outreach. A third is the child health provider outreach. And then the 4th is the data connection and analysis, which is really helpful. Next slide. When we had the registration for all the participants listening now, I know you're from all across the country, which is fantastic. So just wanted to flash this slide to show in green where all the different states that have Help Me Grow systems so that you can go to their website and see if there's an affiliate near you. Next slide. And so why did we choose Vermont and Washington? So the speakers are going to introduce themselves and their roles within their respective states and communities, but just wanted to let you know why we chose these folks. The first for Vermont. So first, they again are a statewide Help Me Grow system. So you'll learn about it at the state level. The second reason is that one silver lining of the pandemic, if you could call it that, is that it really highlighted the importance of high quality childcare. And so because of that, Vermont's anticipating pretty significant legislative support for early childhood in the wake of the pandemic that we'll learn about how that can fit together with things like food insecurity and social determinants of health. They also have really innovative health, early childhood and health collaborations you'll learn about. And finally, they completed a food insecurity screening led by the early childhood sector that's really interesting and could be a great model for other places. Our second set of speakers are going to come from Pierce County, Washington, and they are an example of a local Help Me Grow system. And so they also are going to share about some of their effective pediatric partnerships and provider referral systems that connect with early childhood, again, linking early childhood and health. And then we're going to hear about a really robust asset-based food pantry system and that frames things from a resiliency perspective. And so then at the end of that, we'll be having a Q&A. And so with that, I'd like to turn it over to our Vermont team and thank you all for presenting.
Hello, I am Beverly Bogat and I am the Director of Early Childhood Early Childhood Education Healthcare Integration here at Let's Grow Kids, as the slide had said. And I'm going to just kick us off. Let's Grow Kids is a little bit of a unique organization. We are a philanthropically funded nonprofit organization with a mission of developing an accessible, high quality, affordable childcare system for all Vermonters. And we work in partnership with early childhood educators, as well as other key stakeholders all throughout Vermont to try and create policy change. Our ultimate goal is systems change so that all Vermont children have access to high quality care by 2025. Right now, we're really excited because a lot of this work is coming to fruition. We have a bill, H-171, that has just passed the Vermont House of Representatives that will help lay the groundwork for putting this vision into place. And it is now under consideration in our Senate Health and Welfare Committee. So if anyone's interested in learning more about that, glad to talk offline and or feel free to go to our website at Let's Grow Kids to learn more about that policy, that exciting policy work. But today we're here to really talk with you about the other part of our work that we do in systems building and systems development with early childhood education and the exciting opportunities where we're trying to connect that with our healthcare providers. So we do define high quality early childhood education system as one that aligns early childhood education with healthcare. And so when you can go to the next slide. And so you can see that we see the family very much at the center of that system, wrapped around with systems of food and housing and other social determinant of health security, healthcare, and responsive, dependable childcare system is our goal. And so at a statewide level, both at our state health plan and in our early childhood action plan for the whole state, we have the goal of ensuring that all children have a healthy start by optimizing the development of every Vermont child. And it's this model that we're trying to put in place. So on the next slide, one of the ways we started this work together was really by developmental screening. And Help Me Grow, our statewide system, reached out not only to primary care providers and home visitors to do some developmental screening for children, but they also saw the opportunity in working with the early childhood education system as another way of really connecting and finding families who might need some additional supports. The developmental screen, we really see, this is kind of a complex slide, but at its heart, what we see on this is the importance of the developmental screen as a tool to sometimes identify or uncover other family dynamics or other social dynamics in the family that may be contributing to a developmental delay that we want to identify early and then work together to connect them to supports and services. On the next slide, you'll see that even before the pandemic, we were noticing that food insecurity for many of our families was a concern. And this was just before, even before the pandemic. We certainly saw this number increase during the pandemic. So I think the important thing I want to say before I hand this off to Tanya to tell you a little bit more about our food pilot, and if you just go one more slide, is we really saw that aligning early childhood and Medicaid was the tool and the link to help us go that next step. As I had said, we'd already seen the importance of developmental screening. We'd already been working with our Help Me Grow partners to train hundreds of early care educators to do the developmental screen, to put that data in a statewide data registry, and to help connect those families to our Help Me Grow system and call center so that they could connect it to the supports and services that they needed. It was for us a real natural next step to then want to work with our healthcare partners more closely, and aligning early childhood and Medicaid gave us that opportunity to bring our accountable care organization, our statewide accountable care organization, One Care Vermont, and our Medicaid department, the Department of Vermont Health Access, to the table, along with the Child Development Division and the Department of Mental Health, to begin to say, how can we align all of our work to support children and families? We, because of the data and information I showed you about our work together in developmental screening, what we were seeing for food insecurity screening, for food insecurity needs, we then established the opportunity to do food insecurity screening in the early care and education system to leverage those relationships and the trust and the frequency of the contacts in those settings, along with the early care educators' expertise in child development, as an opportunity that we wanted to explore with our Aligning Early Childhood and Medicaid work group. So with that, I'm going to hand it off to Tanya to tell you about how we put that into place with our food insecurity pilot, our food insecurity screening pilot.
Thanks, Bev. Thanks, Travis. Perfect slide to start with. So, 2020, despite we went into 2020, our partners, as Bev described, with Help Me Grow and Hunger Free Vermont, with this idea of this food insecurity pilot, because of all the great background, right, and data that Bev just shared. There was a moment, there was some movement, there was buy-in, there was want and desire for this. And so we went in hoping that we would get about 12 programs to participate in 2020. We wanted to do this at a very different time than we did. We experienced some attrition, but we're still able to put together a group of programs across Vermont, as you can see on this slide here. They were diverse. There was family child care represented. There were parent-child center. You'll see in the middle of the state there, a very large linked parent-child center that was in 2 locations, as well as some independent centers. And we went into this knowing that, okay, we've got a tool, right? We have some relationships and all these other things that we can leverage and build on. So we went in with some expectations for, using the tools that we were going to use. And we had some ideas about the training and the model we would follow. We quickly learned that despite a pandemic, right, what I continue to learn. So I'm the person at Let's Grow Kids that gets to do a lot of on the ground work, really getting in there and digging in with early child care providers across the state. And we not only, right, had things like the Aligning Early Childhood with Medicaid group and these other things working for us, but we're really lucky to have a very highly motivated, just force of an early childhood professional community here in Vermont. They're champions and they're really eager to take these things on. And so when we started, we wanted to know from them what they thought about going into this before we, gave them too much. And we were pleased to learn that they really wanted to go in this for the same reasons that we wanted to do this. Like they said, right, we really want to be able to identify and support, right, our families and children's barriers to food. We see this every day, right? And we want to even know more about, right, what contributes to a child's, how food insecurity contributes to a child's and a family's well-being. So that, as Bev cited, that whole family, and as well, I think Daniela cited it too, this multi-generational whole child approach. And the biggest thing that came out that we were really excited about, because again, we felt the same way, the idea of normalizing and taking away the stigmas related to talking about food security. And certainly we felt, from a real anecdotal perspective, that the pandemic created a moment where so many people, we all experienced it in some way, I think, and that really opened minds in another way. So we wanted to continue to dig into that, opening minds, and we were hearing that from the providers as well. I can also say about one more thing I'll say about the participants before we go to the next slide is, these were folks, some of them offered a food shelf and had seen firsthand that they knew their families were insecure. People reported things like having children in their programs who had been diagnosed with failure to thrive, right? Lots of people who were already participating in WIC, but were still having challenges, right? The children with allergies, right? Providers who get that feeling that, what you're feeding them because they were all providing food in the program, were really uncertain about what they were being fed at home, right? And the families, this dynamic of families that go from being food into secure, and this is a fluctuating thing that we really need to be mindful of. So it was really exciting. We went into it with this very, we were all in it, we were all bought in, and we knew what we were going for, and we wanted to engage in families. Next slide. So we went in with, okay, we've got a tool. We have this Hunger Vital Sign 2 screening tool. Our partners at Hunger Free Vermont had done a lot of work with this. And so we had some tools, we had a training set up, and we followed a community of practice model. Let's all get in, let's figure this together and really focus on family engagement, how this can work into our program processes, and how we can use Help Me Grow as that centralized access point. Just as Daniela cited, that place where family and community outreach can consistently get leveraged. Next slide. So what was really exciting, I'm just going to share a few things about our findings. All who participated were like, we are 100% want to continue with this. And not only do we want to continue with this, but we are open to looking at other ways that we can support families in terms of social determinants of health. So we want more, give us more. They're eager. They're eager to get back in person, right? They really wish that they could do more questions, more conversations. Like they really push themselves into these conversations and making it an open part of their programs in the way that families not only interact with their teachers and their administrators and their programs, but with each other too, and in the community, using some of the great food shelf and other community resources and being able to find all of that through Help Me Grow. And just a few quick, there were so many good quotes and feedback, and I just want to share a couple of quick ones before I pass it to Lauren. We've learned that families are struggling and they have learned to trust us for support. We serve a diverse population and some have never had to ask for help. This was rewarding for all. I think it is good information to understand why a child or family may not be able to engage or participate in the mainstream of expectations. We strive to keep barriers that perpetuate poverty to a minimum, and one of the barriers is usually food insecurity. It was described as a tool being easier to use than expected. It was valuable at connecting families to resources. It was valuable at starting these dialogues, and they were looking forward to even more of this in the future. Next slide, and I'll switch to Lauren Smith.
Great, thanks, Tanya. I'm very aware of our time, so I am going to move pretty quickly through these slides, but I just wanted to make note of a couple things from a state level perspective. I'm the coordinator for our Help Me Grow system here in Vermont, and we feel very fortunate that we had the Help Me Grow system that we were able to leverage that has a very nimble centralized access point during both the pandemic and specifically for this pilot project. Our rapid response activities during the pandemic include some of the things that you see here that are very food related, obviously, but we also have, as Daniela mentioned, thousands of programs and services for Vermonters' youngest children and related to food services and supports as well. And so leveraging that for this project specifically, but also as a way to support and wrap around all early childhood professionals and practitioners during this time where we know it's not a question of whether families are being impacted, but how much, and knowing where to send those families. So Help Me Grow has been a key part of our response during this pandemic, and certainly is playing a key role for this pilot project and our work and our vision for the future. Next slide, please. So we, as my colleagues have mentioned, we were curious if implementing food insecurity screening in early education settings would be successful. And what we learned from this pilot was that it was not only possible, but it was quite successful. In Vermont, we talk about screening in general, or screening comprehensively across all 5 domains to include social determinants of health as a way to build family wellness and build resiliency, not only during this pandemic, but beyond. And so our state's vision is to operationalize universal screening practices across those 5 domains, including social contributors of health, as a public health imperative. And we really use this intentional language as we're talking across settings and sectors in early childhood. Our goal is to create an integrated system where those screening practices are normalized, are universally done. And we chose the food insecurity screening tool. You saw it was only 2 quick questions, right? But that, what we know from research in that screening tool is that families that screen positive on that tool, there's a high correlation that those families need other social determinant of health supports. And so we really focused first on developmental screening, and then we implemented this food insecurity screening tool as a way to get at that comprehensive screening for all children in Vermont and improve child outcomes and family wellness. Next slide. And I know I'm really cruising through these. So these are a few of our key takeaways from this project. We are really excited that we have this opportunity to really have this proof of concept and really dig into food insecurity screening in early care and education. We know that early care and learning is public health. I think a lot of us knew that cognitively before the pandemic, and now even more of us, I think, are recognizing that, but more importantly, it's become quite visceral that early care and education is a key strategy to ensure that families are held, especially now, and that all families have access to meaningful connections to what they want, as well as what they need. And with that, I think I will wrap up and hand it over to Washington, and hopefully during the Q&A, we'll be able to answer some of your questions. Thank you.
Thank you all so much for having us here today. You can go ahead to the next slide. Perfect. It's such an honor to be here today to share the Pierce County story with you. I'm Taylor Kerrigan, Healthcare Liaison for Help Me Grow Pierce County in Washington. And since we just got a great intro into what Help Me Grow is, thanks to Daniela in Vermont, I plan to focus this time on Pierce County specifically. Go to the next slide. So as a sub-affiliate of Help Me Grow Washington, Help Me Grow Pierce County is currently on year 3 of a 5-year pilot, and we have completed an entire year of implementation. We're focused on connecting families, community partners, and healthcare providers. And similar to a power grid, we need all of these types of resources and then some in place in order to make sure our families in Pierce County thrive. You can go to the next slide. The Help Me Grow model was identified as a helpful model for our community planning process because of its 4 main components that we've discussed already. So developing a coordinated access point where families and providers can call to be informed of and referred to resources in the area for whatever needs they might have, a monthly data and analysis of what families are calling about to identify the greatest needs in the community and work together to fill gaps in resources, health provider outreach to support prenatal and pediatric providers and connecting their patient families to community resources through the coordinated access point, and then family and community outreach efforts to share information with one another and build a more coordinated system. Go ahead to the next slide. So beginning in July of 2019, we began implementation of these 4 components as they were informed by parents and community partners. And as a system, not a program, the implementation of Help Me Grow Pierce County is shared among multiple providers, all working together across the county. We made it a priority to put staff where the experts already are instead of creating another infrastructure. As you can see, Help Me Grow staff are at the organizations that make sense for the position. In addition to staff capacity, we have 4 action teams based on the 4 main components of community partners meeting monthly who advise on how these services are implemented for Pierce County families. Something else I'd like to point out is that Help Me Grow Washington has actually added 2 additional components that are interwoven into the 4 main components. So as you can see, we have an equity component that was added to ensure that we are being held accountable and prioritizing racial and health equity like we say we are, and not just using those as buzzwords. And also an advocacy component that was added to ensure that we have continued funding, support, and a sustainability plan in place. Since implementation started last year, a lot has changed for the Help Me Grow Pierce County team, and our initial intentions for staffing, in part due to COVID, but also in part due to our constant flexibility and ability to change courses in the moment. We've spent the last year really focusing on what the community and our partners say they need instead of us just assuming needs and moving forward on that. So for example, my position as the healthcare liaison was originally supposed to focus on educating child healthcare providers about the importance of different types of screenings. But when COVID started, the needs of my position shifted to help healthcare providers prioritize social determinants of health needs instead. Additionally, as a system, our model shifted, listening to the community and our partners. We realized that there was an emerging need for basic items like diapers and wipes. So we got together and started the first established diaper bank network in Pierce County. Go ahead to the next slide. So this is a great example of the 4 main components working together to address a major need in our community. So in November of 2019, the Family and Community Outreach Team discussed the need for a diaper bank system in Pierce County. This discussion turned into an emerging need presented by the Health Provider Outreach Team when COVID first started in March due to the rapidly declining availability of the products on the shelves and then limiting how much that could be purchased when they were stocked again. An already established need in our county became an even greater need during COVID. The coordinated access point and data team confirmed this with the amount of calls coming into 211 looking for diapers and identified the zip codes asking the most. And then the Family and Community Outreach team identified where the diaper banks could be located to start with that were actually open and still serving the community. And with that, the Pierce County Diaper Bank Network was formed. And as you can see on the left-hand side of the slide, we have provided actually over 162,000 diapers now from May of last year to February of this year. We've assisted over 3,400 families and 6,400 children during that time as well. And the map that you see actually showcases that we started with 3 locations and now we're actually at 10 locations throughout the county. We formed a partnership with the Tacoma Pierce County Health Department. They have a family support partnership that has 9 locations throughout the county. So we work with them now as diaper bank partners. So you can go ahead to the next slide. All right, so as I mentioned before, the focus of my position changed pretty quickly. I started in March of last year, so the week before we went on lockdown is when I started in my position. And during that first month in March, I attended my first health provider outreach action team meeting. And the group agreed that while the families that they were providing healthcare to, they were losing their connection to the resources. The pediatricians and the prenatal providers, they wanted to act as a bridge to gaps that the families were experiencing. So we created what was called the provider referral form. And what you're looking at now is the process of that form. So this form was created to address the needs and give the provider an opportunity to build a stronger relationship with the families that they serve. And as you can see from this visual, the provider will actually fill out the form during their visit. The form is very basic. It just collects the demographic information of the caregiver and then has a checklist of potential connections the caregiver may need, like food access, rental assistance, legal assistance, other healthcare needs, etc. Once the form has been filled out by the provider, they will then send it over securely to our Family Resource Navigator at 2-in-1, which is our coordinated access point. And the Family Resource Navigator will follow up with the family within 48 business hours. The checklist that the provider filled out on the survey actually acts as more of like a heads up to the Family Resource Navigator, because they will actually do a full screening of the family to address any and all of the needs that they have at that time. Once the Family Resource Navigator has connected to the family, they will actually reach back out to the referring provider and let them know, hey, I was able to connect to the family. Or if they were actually unable to connect to the family, they will let the referring provider know and ask if they might have any other contact information to try again. This form was piloted by 3 different agencies in Pierce County from June to December of last year, and it has been utilized nearly 200 times by those 3 pilot agencies. And it's actually our goal to have this form offered countywide this month. So that's actually all for me for now. So thank you so much, and we will move it on forward to the Bonnie Lake Food Bank.
Hi, thank you so much. I'm thrilled to be here. I'd like to introduce myself as an accidental CEO of a food bank. I'm now the CEO of the Bonnie Lake Food Bank and the Sumner Community Food Bank in our area. Like Taylor, I started my job 10 days before the pandemic, before the lockdown. Prior to that, I worked in corporate finance and also worked in special education for a stint for about 5 years in special education and childhood behavioral health for the school system, which is how I became acquainted with the food bank. The population of children that I worked with was heavily impacted, and I became very interested in food security. And then that accidental CEO part ensued. I am going to, advance the slide here. The Bonnie Lake Food Bank has programs that sort of fit underneath our umbrella. One that I'm going to talk the most about is the Market, which is our food bank in disguise here in Pierce County. Basically Needed, which is our diaper bank through our partnership with Help Me Grow Pierce County. We have a diaper bank that provides services to families. Food for Kids is our backpack program. This is a weekend supply of food for 250 students in our area every week. And then Farm to Fork, we're actually the Market, which I'll tell you more about, is located on a farm, and we work with first generation local farmers to just help boost the food system in our area. 2020 was an epic year to start a new job, and definitely an epic year to start a job in food security. The Bonnie Lake Food Bank was serving about 100 to 150 families every week. And now we serve over 1,100 each week. We had a 700% increase, which sort of defied odds, really, to be honest. And we scaled in a way that, nobody could anticipate. And I want to tell you a little bit more about that scaling. Very quickly in the pandemic, I attribute our growth factors to our rapid innovation and our access and how we define access. We quickly hired an appointment coordinator that was on call 7 days a week. We have a self-service online grocery registration. So families new to the system were able to access us immediately with a pretty intuitive way where they never even had to talk with anybody if they didn't want to. We created a stigma-free white van delivery service, so it just looks like an Amazon delivery coming to your neighborhood. We have a text broadcasting communication system through Avocado. We were actually part of a case study. We were one of the, well, the first food bank that used a broadcasting system like this. We're able to contact all 1,100 of our households in 3 languages in 30 seconds, which helped us tremendously when we had wildfires here in Bonnie Lake. We were able to speak about emergencies, but we can also send things like the pandemic SNAP benefit information on PDF. It's an instant way for us to contact all of our families. And like I said, 30 seconds is kind of unbelievable, honestly. We standardized a lot of our processes through our work with the Washington National Guard. I'll tell you more about that. And then we have an on-demand drive-through system where it's no questions asked. People can just come through every day. I want to tell you a little bit more. Our story is it defied the odds in a lot of ways. This was the building that I inherited at the beginning of the pandemic. It looks like a lot of food banks, honestly. Our infrastructure was nothing, right? Zero infrastructure. And to think that the weight of food security for the nation is hinged upon organizations a lot like mine is just unfathomable. So we worked in this building for the majority of the pandemic. It was unsafe. It had black mold. I mean, you name it, it had it, including lack of social distancing. We just weren't really able to serve in this building, but we did the best we could. And then oh yeah, I just have to show you. I'm a storyteller, so I just have to show you how epically horrible it was. And then December 1st, around September, we got an opportunity from a landowner to lease a building out on his farm and renovate it. So we have very cheap lease, only $1,000 a month for this gorgeous building. And then we completely renovated it from top to bottom. We moved on December 1st with the help of the National Guard. It was a $450,000 capital campaign budget, but out of pocket, we paid about $125,000, completely funded by the community, and everything else was in kind. Our future plans for this place is to create a community garden where we pay attention to access to all. Community gardens are also systems where not everybody can play traditionally. We want to design a food forest. We're going to create a teaching and sensory garden, hydroponic greenhouses so that we can be more self-sustaining. And we are leasing space currently to small farmers. We also plan to integrate STEM and agricultural engagement programs for our local school systems. This is my favorite slide, and these are 3 words I talk about a lot: dignity, equity, and access. I really like to talk about what it looks like, sounds like, and feels like. A lot of times you can look at these things and say, yes, my organization provides that. We serve everyone. But what that really looks like is, I think, entirely different and good to talk about. And this is a conversation my organization and we are talking about all the time, and just reworking that and making sure that we are doing the absolute best we can to really reach all communities. So what it looks like is customer-centered practices, comfortable, beautiful places to shop, less rules, more grace, delivery in unmarked vans, grocery bags, just like everybody else versus boxes, multilingual communication, a focus on convenience, because this population deserves convenience more than anyone, and it's seldom afforded. Diverse staff so that people can walk into our building and see people that look like them. No paperwork, no institutional processes, text broadcasting, a customer service staff. I refer to them as customer service. No appointments, no list, easy online sign up, and saying customer, not client, because food security is just a grocery store where people don't pay for it anyway. What access looks like is I have all of my employees online that they can communicate from laptops anywhere on Wi-Fi. We have our van, a fleet of vans now, and Avocado, we can communicate with all of our customers. All my employees have a cell phone that hook up to this app. All of our communication is in the 3 main languages of the people that we serve: English, Spanish, and Russian. And then the delivery system is an incredibly equitable gesture in terms of, in a rural area like East Pierce, people run out of gas and they simply can't afford to put gas in their van, in their vehicles. If their car breaks down, they have no access to food. You can't really walk to a grocery store in our area. So it's very important that we brought service to them. I think that that's important in a lot of human services. The other thing we wanted to define, I told you about customer service staff. We also have a food steward. We're in the food business, and quality, healthy, beautiful food is part of our business and our responsibility. Jen has also worked in education with a heavily impacted community, multicultural, and she is just so in tune with the foods that we provide and how we help people incorporate them into their life. We have QR codes on all of our displays so that somebody can scan that and come with pull open recipes in multiple languages for each of the foods. And she just does a beautiful job. I like to tell her that all of her lettuces look better than bouquets. So when our customers open up their food and their grocery bags, it looks like a gift. It doesn't look like sloppy leftovers. I like to celebrate food at the food bank. We talk a lot about food scarcity. I like to talk about food bounty and creating systems that are bountiful and plentiful. It's just kind of a change of a narrative that it's a choice, and it changes everything, honestly. It changes how everybody feels about the business that we work in. This great group is the group that handled our Backpack for Kids program over the summer. The community has helped us in tremendous ways, and I found that connecting the community to our mission in ways that everybody can play, it's also giving our community access to our mission. Food security is so very heavy, and providing different ways, like working on a farm in a community garden or doing this backpack program, those are different ways that we can engage our community that might feel softer. We also engaged the community. We got this beautiful van. I had a fleet of 11 vans, you guys. None of them worked, vans and trucks. All of them had garbage in them and rotten food and vermin. That's what I inherited along with that precious building that I showed you at the very beginning. So when we got this van, this was a huge deal, and we wanted to engage the community in the bounty of what it meant. Turns out they wanted to name her Vanna White. Get it? Vanna White. And we call her our Wheels of Fortune because it changed everything for us in terms of being able to provide a delivery service to rural clients. The National Guard was also very critical in this journey. They helped us optimize everything. I call it kind of a marriage of odd couples. We have these highly disciplined folks that are very mission oriented, and they want to optimize all things. And then, you know, us, we're just bleeding hearts. I've got 2 minutes, you guys, so I'm going to wrap it up. More pictures about engaging youth and the community in our mission. Our move to the farm, I wanted to show you a few pictures. Oh, I got a little click happy, but you can see that, you know, part of the farm and our outreach here is to create a space that people want to come to. It's very important to me that no child in our community ever knows the stigma and shame of having to go to a food bank. I want them to just think it's a grocery store and a joyful place about bounty, not scarcity, not depression, you know, depressing surroundings. I want it to be light and hopeful. And I don't really feel that there is a reason why, you know, that some organizations look institutional and kind of depressing. I don't know why that narrative exists. So most of this year I spent asking why about a lot of these systemic norms. And the farm is just kind of that beautiful manifestation of all of those questions. This is our little basically needed barn. I call that our CBS. So the farm is, the main building is our Metropolitan Market. And then the basically needed program is our CVS pharmacy right beside it. And I just wanted to end with a team of very strong women that I work with that, you know, have arrived in the business of food security, not unscathed by life. And so the pandemic has been such a great thing for us to each use these individual histories and traumas of our own and create something great, create a better story with it. I couldn't have done anything without this group of women. I'm so thankful for everything that's happened in our community. I think that's it, you guys. Thank you so much for having me.
Thank you to all of our presenters. Really appreciate just the thought that you've put into these presentations, and they have created quite a few questions. So I think if everyone can put their videos and speakers back for the panelists, I'm going to see if I can somehow sort through and kind of chunk the different questions that have come up. I think the first one I'll start with is going towards probably Taylor. You might be the best fit. And we actually got 3 different questions on the referral process that kind of feel like they fit together. So I'm going to say them all in once, but if you need me to then delineate them again, that's fine. So part of it is trying to understand who the family resource navigators are. Are they like community health workers, or are they trained public health providers? Then adjacent to that is, how is the referral process facilitated? Is it pen and paper, or is it technology? And then what other types of chronic diseases or tobacco or substance use issues are being screened? So I put it all together because I think it's all one system, but happy to break it down a little bit.
Yeah, awesome. Thank you. I want to say too that the Help Me Grow Pierce County Program Manager is with me today, Kate Ginn. And so I'll have her answer the question about the Family Resource Navigators, but I'll go ahead and address the second and third questions. So the form itself, we will be offering a fillable PDF form on our website for providers to use, but it is actually utilized however works best for the workflow of the provider that's using it. So one of our piloting agencies, actually 2 of our piloting agencies, implemented the form into their EMR system. They use Epic, so they entered it into Epic, and it was just a tab that they could click on and just fill it out right then and there. And then they would securely email it or fax it over to the Family Resource Navigator at 211 that way. And then the other agency, they actually printed it out and filled it out with paper because that was just the easier way for them. So really it's based on the preference of the provider utilizing the form, as long as it gets to the Family Resource Navigator. That's the biggest piece. And then the screening that goes on with like what referrals and resources the families are connected to. The Family Resource Navigators actually do a very robust screening that will include things like, tobacco cessation, if that's something they're interested in, or, if they have been diagnosed with other chronic diseases and they need follow-up with that, they'll dive deeper into that with that conversation with the Family Resource Navigator. So typically a family will call for like 1 or 2 reasons. For the past year, the reason has been for rental or mortgage assistance, or access to food, or basic needs like diaper and wipes. And they will actually end up leaving that conversation with more than about 5 to 10 resources and referrals. And the Family Resource Navigator actually spends the time, signing them up and really getting them, that referral, not just here's 10 resources, good luck. It's let me help you through the steps of, getting signed up for this and all that. So Kate, if you want to go ahead and answer about who the Family Resource Navigators are, I will give that to you.
Thank you. Hi, everyone. I'm Kate Ginn, manage Help Me Grow Pierce County. And I will add to what Taylor said as well. We're also the referral pathway for pregnant women with substance use disorder who are reported to Child Protection Services. They obviously can't do anything and shouldn't do anything because the child is not born yet. Instead, they send those over to our Family Resource Navigators, who reach out to offer voluntary services, including substance use treatment. So just wanted to mention that, but our navigators are not community health workers necessarily, or public health professionals. They are parents with lived experience having to navigate resources themselves. For the most part, 2 out of 3 of them, I would say, are parents. So we really highly value them being able to build that rapport and talk to families, even sometimes about their own experiences, to walk through that with them.
Great, thank you all. The second question, I think maybe I'll go to, it could be to Washington or Vermont, but we'll start with Vermont, because we heard from Stacy about the focus on the beautiful foods and the green and the healthy, and for the nutrition component. For Vermont, when you do a screening and then your referral, is there also a focus on nutrition and healthy foods in addition to just the access? And how is that handled?
Tanya, you're the closest in working with the pilot participants, and as a former early childhood educator yourself, I think you could probably best respond to that.
Yeah, this is actually really important to us in Vermont. We have a very proud farming tradition here, and a lot of farmers. And so this is something that we've seen some models of this happening in communities of Vermont, where, you know, part of the access to nutrition is getting, you know, farm shares, getting the food from locally sourced foods into the hands of everyone in the community and providing access to that. And so that is something that we were learning about and talking about through the food insecurity pilot process. But we also have a very strongly building farm to school initiative that is sort of taking like the next step of this work, right? That group is also thinks that food insecurity is really important, but they're going to be very focused on those connections and studying more about those models in Vermont. But there's a lot of folks doing it and trying to get those very locally sourced groups and linking the farmers and the educators.
Yeah, I would just add one thing, and that is to say that nutrition's already been a big part of what early care educators do, and that they build that into a lot of their programming. And so that's why when we were asking them to do food insecurity screening, it was like a very natural and comfortable topic area for them, because they were already talking to some families about that. Most of them already had some sort of food and nutrition program in their classrooms, and this was a big part of their education, you know, content.
Yeah.
Gotcha. Excellent. Thank
We've
you.
got a lot of buy-in in Vermont for this, right? There's already a lot of buy-in. We think it's something that, like, you know, there was a question, like our legislators are already understanding that this is an integral component of high quality early care. And now trying to figure out, like others are saying, how do we build this into the system? How do we build this into our daily practices and into the funding model, and that, you know, our pie in the sky 2025 access for all to high quality.
Great. Thanks, Vermont. I'm going to kick this next question to you, Stacy, which is asking about, first, accolades for all the work that you've been doing. But the second one is, do you have plans to engage health literacy programs for community members that have co-occurring health conditions impacted by food insecurity? So celiac, failure to thrive, et cetera.
Yeah, those are great questions. And I think that is the next level of our work. Our organization is in infancy right now. So part of my partnership with, you know, Help Me Grow is to understand other ways, because other ways we can serve our community better. You know, with the scale of how quickly we grew with this delivery model, it has taken, you know, I could stay up all night and, you know, 7 days a week to manage that. And so right now, I would consider us a food bank startup, if there is ever such a thing. So although we're a 10-year organization, in this year, you know, we have had to create entirely new, you know, governance systems and financial systems, and, you know, we're exploring that. And I do feel that part of that community garden aspect is going to be sort of the venue for those activities to take place, but I don't exactly know what that looks like yet. And that's why I participate in things like this, because I want to understand that more. I tend to stay really very right now focused on that, the food resource and access, because it is a crisis within a crisis within a crisis that's happening. So I'm heavily focused on that right now because it's so emergent. And, you know, working with our local Pierce County Sheriff to make sure that they have inserts that will fit just in their uniform, and they can grab it and hand it to impacted families when they are out on calls. Things like that, that are like super practical, everyday solutions to recruit more and make sure that I'm reaching everyone. So I have told my board, and that's something we're working on, is like, what's the next level of outreach? Because, you know, food security is just a symptom of so many different things. We know that this is just a symptom. So, you know, great question. And that's, you know, again, why I'm here and having these conversations with these partnerships.
Actually, Stacy, you teed it up perfectly for one of the other questions that was saying that we know that there's a big correlation between food insecurity and then housing instability and unemployment and homelessness and all of that. Yeah. And it feels like you all have a different piece of the pie. So maybe to everybody, how are you connecting to maybe the bigger structural systems or informing the data that they need to influence policy? How's that coming together?
I can start. So when we did a community planning process for how we wanted to design the Help Me Grow model for the specific needs of our community, We chose 211 as our coordinated access point because one of the biggest needs is housing, and they're also a central access point for housing navigation, along with a multitude of other basic needs. So we looked at who has the most comprehensive resource directory and then decided, we're not starting something new, we're increasing capacity at the agencies who are already doing the work so that they can serve more families and we can all work better together. So I have a data team that looks at the caller data every month to identify the gaps in our community. What are the things families are asking for? And where do we not have enough referrals to give families? And then really look at the zip codes. We chose our diaper bank locations, as Taylor mentioned, based on the zip codes of who was calling asking for baby supplies initially. So we're really able to use that data, share it with our local elected officials as we advocate for further investment and where it's needed.
Great,
And
thank you.
I can just piggyback on that from Vermont and from the Help Me Grow national perspective. I think, one of the huge assets of the Help Me Grow system is this data collection component and the CQI that goes into that, as well as the fact that for a Help Me Grow system or an affiliate, that it's the closest thing to whole population data set that you can get. And so it's really valuable to our leaders and our policymakers. And in Vermont, we recently stood up a specific team that is aligned with our goal number 1 in our early childhood action plan, which that goal is all children have a healthy start. And so we are working really hard to make sure that we have leaders and advocates and allies from all the various sectors. Historically, that meeting or that team has been primarily made up of direct service providers, but I think again, COVID has just highlighted the fact that we need folks from housing agencies and from employment agencies and from food related resources. We need all of those folks at that table to be identifying the needs of families. And then our team within Vermont has a direct line up to our state advisory council, which is the early childhood council that advises our governor around early childhood issues. So we kind of have a nice pipeline there. But I think just the composition of that team specifically in Vermont and the fact that we're just really broadening kind of the range of folks that we want to have at that team informing those types of things kind of hits on all the the structural and social conditions of health that the folks that have asked that question touched on as well.
And there's a good resource. Can I just add a quick resource? I'm from
Sure.
Vermont with Lauren too, that, what she cited as like our state advisory level, it's called Building Bright Futures in Vermont, which is very easy to find online. And every year they put out the How Are Vermont's Young Children report, which is a really interesting document so just a resource for folks out there. It's very easy to find online.
I think
Great.
I wanted to just add too,
Yeah.
if I could, from I like to give sort of on the ground, perspective into, because I'm kind of the eyes and ears right on the front line of seeing some of these things. And with the delivery program and with our Avocado texting app, what I found, where I thought I would be further disconnected from my customer base, I'm very much more connected. They tell us more. There's an anonymity with the texting. We know more about their life, and we also know their biggest secret, which is where they live. And that was something that they held from us. It was sort of their last secret, And so there's a vulnerability in that, but there's also this like deeper connection of trust that we have built. And so with what I'm noticing, just as somebody that is not the usual suspect and kind of new on the scene here, what I'm noticing is that the most impactful, systems are where the service goes to the customer, that it is a more mobile sort of pop-up type venue. What I'm finding is it's so very difficult for our customers to get to us, to keep those appointments. Their lives are, in crisis every day. And so that cortisol in their frontal lobe makes it so hard for them to navigate systems. So if there's a way for us to come together and have very user-friendly venues for services, and that's the type of partnership that I am looking for right now, is something where I already know they're coming to me and that they trust my girls and that we have this relationship,
That is a perfect closing, and I know we are exactly at time. So I just want to, for that last, thank you, Stacy, and thank you to all of our speakers. Armel, I know there's some real quick wrap up in the last 30 seconds that you're going to point everybody to.
Yes, so thank you, Travis, for your assistance with the webinar today, and Daniela for moderating the Q&A, such fantastic presentations and questions. Please complete the brief online survey. Your feedback is very important to us, and we hope you will take a moment to do this. As you open up the survey link, we want to say a big thank you to our funder, the Robert Wood Johnson Foundation, for supporting the work, and to all of our presenters for sharing their stories and strategies around leveraging early childhood programs to address food insecurity using screening tools effectively, focusing on systems change, destigmatizing food, as well as focusing on social determinants of health and the need for a healthy start for all of our young children. And last but not least, thank you to all of you for participating in this webinar today and for submitting all your great questions and for all that you do every day to help families thrive. So have a wonderful rest of your day, and thank you, everyone. Bye-bye.
Thank you.